My passion for medicine. I think, I was never one of those kids that always knew they wanted to be a doctor early on in life, but I was always interested in science and in math and those types of disciplines. And as I went through my career, through college and medical school and graduate training, I continued to love that science and math, but once I started getting into the clinical realm, I really just found an enjoyment for medicine. And I think that's really what drives my passion, is just that I enjoy it. I enjoy the intellectual challenges of trying to help patients and figure out what's bothering them and how we can help them. And also the interpersonal challenges of interacting with patients and their families. And all of those attributes of being a physician really keep me going and make me enjoy my job. I enjoy coming to work every day, and I think that's an important feature of any profession one chooses, and really have a good time doing what I do. There was one patient and patient's family that I do recall and I think about, every now and then, that sort of keeps me going. And it was a family where their young infant was born again with some very complex heart disease and was not going to be able to tolerate the plumbing that she was born with and was not able to survive. And the family had bonded with me over the weeks that we were trying to do the best for their infant. And when it came time that the patient was not going to tolerate the plumbing, they had asked for me to come in on a weekend that I was not on, and which I was more than happy to do. My family understands that. It's one of those things that comes with the job. And as I was driving in, I was, emotional about the situation. And when I entered the conference room, to meet with the family and the rest of the medical team, the dad's first response to me was, "See, this is the downside of being a great physician." And I think about that quote all the time, because I think, yes, there are some downsides. Maybe you're at the beck and call of your pager more frequently than other professions, but the fact that they saw me as somebody they wanted to reach out to in this time of their need, and wanted to do so because I had treated them well and they thought that I was an outstanding professional for them, really touched me, and something I think about and helps me get through those difficult times in the ICU and moving forward in my career.